Well, today we will talk about malaria. Malaria is a parasitic disease that involves high fever, chills, flu-like symptoms, and anemia. Malaria or malaria is caused by a parasite that is transmitted to humans through the bite of infected Anopheles mosquitoes. After infection, the parasites, called sporocytes, travel through the bloodstream to the liver, where they mature and produce another form, called merozoites. Parasites enter the bloodstream and infect red blood cells. Parasites must be within the red blood cells, which break off after 48 to 78 hours, infecting more red blood cells. The first symptoms usually occur 10 days to 4 weeks after infection, although they may appear even within 8 days or up to 1 year after infection. Symptoms occur in cycles of 48 to 72 hours. Most symptoms are caused by the release of merozoites into the bloodstream, anemia resulting from the destruction of red blood cells, large amounts of the hemoglobin released into the circulation after rupture of red blood cells. The first symptoms of malaria include irritability and drowsiness, as well as lack of appetite and problems falling asleep. These symptoms are often followed by chills or the fever associated with agitated breathing. The fever can increase progressively during 1 or 2 days or to rise suddenly to the 40 degrees Celsius or even more. Then, when the fever subsides and the body quickly recovers its normal temperature, an episode of intense sweat occurs. The same pattern of symptoms, chills, fever, sweating, can be repeated at intervals of 2 or 3 days, depending on the particular parasite.
because the initial symptoms are not specific to this disease and may be confused with those of other diseases. Malaria can be difficult to diagnose. In countries where malaria is prevalent, it's not uncommon for physicians to administer malaria treatment to people who have a fever in absence of obvious cause with even confirm the diagnosis. Through laboratory tests, other symptoms of malaria include headache, nausea, pain, and discomfort through the body, and abnormal enlargement of sleeping. When malaria affects the brain, there may be seizures or loss of consciousness. If it affects the kidneys, it can greatly reduce the amount of urine produced by the body in falciparum malaria. Caused by the parasite Plasmodium falciparum, episodes of fever and chills are especially intense, and this type of malaria is fatal in approximately 20% of cases. Once the parasite enters the bloodstream, they travel to the liver where they multiply. Every few days, thousands of parasites leave the liver and colonize the bloodstream, where they destroy the red blood cells. The incubation period of malaria is the time that elapses between the mosquito bite and the outbreak of parasite from the liver. The duration of this period will depend on the malaria parasite that caused the disease. It usually varies from 10 days to a month. With treatment, malaria usually heals in about 2 weeks. Without treatment, it can become deadly, especially in malnourished children. Malaria can also be transmitted from the mother to the fetus and by blood transfusions. Mosquito in temperature zones may carry malaria, but the parasite disappears during the winter. This disease is a major health problem in most tropical and subtropical countries. The United States Centers for Disease Control and Prevention estimates that there are 3 to 500 million cases of malaria every year, and more than 1 million people die from malaria. This presents a great risk of disease from travels to hot climates. In some regions of the world, mosquitoes that transmit malaria have developed resistance against insecticides.